Imagine a patient sitting in your clinic. They describe an agonizing pain, but they can't point to where it hurts. The ache is chaotic, erratic, and refuses to stay in one place. 1 minute it is seizing up their neck. The next it is shooting down into their toes. They are completely exhausted, shivering constantly. And if they happen to be pregnant, they might experience agonizing false labor pains. In homeopathy, these highly specific symptoms act as precise coordinates, pointing us toward a specific remedy. Observe a specific clinical marker, a pregnant woman whose fingers suddenly seize with a sharp, paralyzing pain, localized entirely in the small joints. That specific presentation identifies the medicine, Caulophyllum thalictroides. In clinical circles, it is known as the blue cohosh, the spasm king, or the shivering mother. Recognizing the precise profile of Caulophyllum replaces a chaotic presentation with a singular, effective treatment path. To understand how Caulophyllum works, we can systematically map its symptoms starting from the extremities. Look specifically at the hands. The patient experiences noticeable swelling and stiffness. When they try to close their fingers, a sharp, cutting pain strikes directly in the joints. That agony extends into the wrists, presenting as a severe, downward-drawing ache. There is a unique clinical detail to look for here. Often, the only thing that provides relief from this rheumatic agony, so the patient can sleep, is wrapping their hands in a mustard poultice. The reach of this remedy extends beyond single joints, manifesting as flying pains that travel throughout the body. A spasm might originate in the sternocleidomastoid muscle of the neck, drawing the patient's head sharply left. Then, an instant later, that pain darts down to sting their toes. As the patient walks or turns, this erratic muscular tension causes their joints to audibly crack and pop. The physical pain profile of Caulophyllum is defined by this chaotic mobility and its intense concentration in the small joints. Historically, Caulophyllum is known as squaw root because its deepest action centers on the female reproductive system. During labor, the uterus falls into a state of atony, a muscle that has lost its tone. The resulting pains are short, spasmodic, and irregular. This split-screen graph shows the difference in contraction rhythms. On the left, we see the solid, continuous wave of cicale. On the right, we see the short, irregular spikes of Caulophyllum. These irregular spikes are false pains. They cause agony, but fail to progress labor, simply passing off with an exhausting shiver. If the uterus remains too weak, this lack of tone can lead to passive, dark fluid flooding after delivery. This exhaustion triggers the defining systemic symptom of Caulophyllum, internal trembling. It is a deep-seated weakness that shakes the patient from the inside out, even if they appear still on the surface. This systemic weakness leaves physical marks, like chloasma, dark moth-like pigment spots on the forehead. It also triggers a weakening, acrid discharge in young girls. During acute illness, this underlying weakness manifests in the digestive tract. It produces a stream of white, watery, entirely painless stool at exactly 1 a.m. Ultimately, the internal trembling and uterine atony point to a body attempting to function, but lacking the steady, energetic strength to do so. When we zoom out and look at the entire anatomical map, the swollen fingers, the darting neck spasms, and the exhausted uterus all form one cohesive picture. Caulophyllum is the definitive remedy for a patient caught in intermittent struggles and exhausted, fruitless spasms. To recall this in the clinic, you can rely on 3 pillars. The first is weak spasmodic labor. The second is the presence of flying rheumatic pains that target the small joints. And the third is that deep-seated, invisible internal trembling. When you recognize this exact triad of symptoms, you can confidently prescribe Caulophyllum thalictroides.